Do you understand what I'm referring to? Right. So that being said, let's talk about the most common types of prescription drugs. And they're, prevalent all over society. What is the most prevalent use of prescription medications? What's it for?
Pain.
Pain, absolutely, without question. Okay, so most people, especially in here, we're getting a little older in time. Not saying anybody's old, but you reach a certain age, and things start to fall apart a little bit physically. So, what is it that usually most people go to pain management doctors or pain management clinics for? What's the most common ailment? Back pain. Absolutely. Back pain, neck pain. So back and neck are the primary culprits in terms of degeneration or injury. But any kind of bodily pain, spinal or peripheral nerve or axial skeleton issues are primary. So back and neck, we'll stick with back and neck. What are the injuries most commonly associated with back and neck injury?
Disc.
Car accidents, but the discs are part of the anatomy and physiology of neck and back. But what causes the abnormality in the first place?
Cars.
Car accidents, slip and falls. What's that? Lifting heavy stuff, so physical activity or overexertion. Absolutely, okay? Now, those are all common themes, right? So when you think about it, you would think that's the vast majority of people that go to pain management are from those things, but it's not. It's not the majority. It's actually quite the minority of people have those physical injuries from car accidents, slip and falls, overexertion or accidental injury, and so on. The vast majority of people go because of aging. Okay, I got news for you. Even if you're in really good shape and you eat reasonably well, age is going to catch up to you, and you're going to get the most common of the reasons people go in is degenerative joint disease. Degenerative joint disease. Now, a small percentage of people have that until around age 40. Around age 40, that becomes the most prevalent ailment in most people who are becoming of that older generation. And they start to have aches and pains, not because they slipped and fall, not because of that, but from normal wear and tear. Degenerative disc disorder, bulging discs. I hear that all the time, especially with people from pain. Well, I have slip discs or bulging discs and herniated discs and so on. All of that is part of degenerative joint disorder. It's progressive. When you get older, the percentage of people without having severe accidents or slip and falls or stuff, just through wear and tear, a vast majority of society, especially men, are going to have those ailments. Okay? It's just part of aging. So it's normal. It's just normal. It's the wear and tear of the human anatomy and physiology. Sorry, but that's the truth of the matter. Okay? So after a certain time period of existence and doing normal wear and tear work, especially if you're in construction or if you played sports or those types of things, you're going to wear out a little quicker. So the majority of people go in, see the doctor, and they're like, I got back pain, got neck pain, arm pain, shoulder pains, especially the synovial joints, the ball and socket joints. Those types of injuries or degenerative progression of those injuries are why most people go see a pain doctor. Now,